Good. Yeah, so I'm Cameron McKinzie. I'm one of the two pediatric pharmacists or CPPs at UNC's CF Center. And I'm going to tackle the first bit of these slides and then turn it over to Charissa. And we're just going to talk through several things related to medications and hopefully then have a good, fun discussion.
Yep, and I'll introduce myself real quick. And like Cameron said, my name is Charissa. I am the other PEDS CPP, PEDS CF CPP. I joined the team in December of 2019. I had done my training and had done some practice out at Texas Children's in Houston before coming back to North Carolina. So excited to be here. This is very informal, so please feel free if you have questions to either put it in the chat or ask us kind of as we're going. We're more than happy to answer those questions. So Cameron, you can take it away.
I will let you drive the slides. There we go. Okay. So we had some fun finding graphics because I think, you know, as parents, I am learning with an almost 2-year-old and a second one soon to be here. That just in general, there's a lot asked of you. You're balancing multiple things, multiple people's requests. And then with your child having CF, we add a whole host of medications because you didn't have enough to manage already. And so I think what that can result in is feeling just a little bit, at times overwhelmed of just how you manage all of the different things that are on your plate. So we wanted to start by acknowledging those challenges and some of those things that you guys are dealing with, but we also wanted to acknowledge that we very much think that you guys as CF parents are complete superheroes. You're balancing quite a bit and all, you know, for your kids. And so we just wanted to start with a little lighthearted version of it, much better than I could draw myself, but acknowledging all of the things that you guys are doing and balancing. So in this presentation, we are going to cover a couple of things. We wanted to explain or kind of describe the difference between a specialty pharmacy and a retail pharmacy. I think for a lot of people, it can be a little unclear as to why sometimes you need more than one pharmacy, and talk about ways that we can help you potentially streamline the number of pharmacies you have to use. We would prefer you didn't have to call 5 places every month to get all the things that you need. And then we're going to review some of the available CF patient assistance programs, as well as programs that are out there to help with obtaining vitamins and nutritional supplements. It will not be an all-inclusive list, so if there are other ones that you're curious about or have questions, stop us at any point. And then Charissa is going to share some tips for medication organization and talk about some of the medication adherence mobile applications that are out there. So I think if we took a poll, depending on how many folks are parents, I think the vast majority of CF patients often have to use at least 2 pharmacies, and oftentimes even more than that, just to fill their medications on a monthly basis. So that includes things like a retail pharmacy, which a lot of patients, you may have a retail pharmacy close to home, like your local CVS or Walgreens. You also might have a mail order retail pharmacy, and then you may have a separate specialty pharmacy. Add to that, sometimes depending on your insurance coverage, you may need a different location that helps with filling vitamins and supplements, and it very quickly becomes a little unclear as to who you call to get what. So specialty pharmacies are a little different than your typical retail pharmacy. The reason is that they are primarily dealing with dispensing medications that are high cost, that require close monitoring, or required special handling. So for our CF patients, some examples of those are the CFTR modulators, so things like Kalydeco, Trikafta, Pulmozyme, or Dornase alpha, because it has to be refrigerated, and inhaled tobramycin. Which specialty pharmacy you can use is a little bit of a moving target in a lot of cases. So particularly for patients who have commercial insurance, the specialty pharmacy you can use is often dictated by your insurance plan, and that's based on contracting that unfortunately can change from year to year. So just because you use CVS Specialty this year, if your insurance changes who they contract with, next year you may get to know Briova or Accredo or Express Scripts. There are some specialty pharmacies that do both specialty and non-specialty medications, which from a pharmacist standpoint, I think is ideal, because we would love to limit the number of places you have to call each month. But again, a lot of times that is really determined by your insurance company. So some of the examples of those are places like Maxor IV Solutions, which used to be known as PSI. They have merged a few times along the way. Alliance CF Services, so Alliance RX is the Walgreens specialty pharmacy, but they also do non-specialty meds. And then here at UNC, we have a health system pharmacy, UNC Shared Services, that can do both specialty and non-specialty medications. So a few other things that are different, just in terms of how you as a patient might interact with the different pharmacies. The specialty pharmacies are generally proactive about calling to schedule refills. That's part of accreditation for specialty pharmacies and just kind of a slightly different type of patient care that they provide. But then for patients who either aren't on specialty medications or have medications at other pharmacies that don't do that, there are lots of other things that many of you probably have a lot of experience with trialing to help you remember where you're refilling and when you need to do that. So things like some pharmacies use the automatic text refill reminders that come to your phone. Anytime that the pharmacy is able to, I think requesting to sync up those refills is really helpful, so that hopefully you only have to make one phone call a month instead of calling each week because things got sent at different times. Things like your pill box can be helpful, because if you're filling a week at a time and you realize that after that week you're going to be out, that gives you a chance to proactively call and set those refills up. And then things like a physical calendar, which I'm old school and love a pen and paper and a to-do list, or the apps that Chris is going to talk about later. So we'll hop over for a second to some of the CF programs and patient assistance. There are a lot of programs out there that offer all sorts of different assistance, whether that's support to patients, financial assistance, help with getting other products like the nutritional supplements and vitamins. And it's a lot to manage. I think every few months, I feel like I learn about a new program or a new opportunity. So it's a great thing, but I think it can be really overwhelming just to try and keep up with. So I will plug here, we have a fantastic resource in our clinic at UNC. Her name's Billy Simonson, and many of you may already know Billy very well, but she is a pharmacy technician specifically embedded in the Peds Pulmonary Clinic, who manages all of our patients' medication access. So things like insurance approval, if we need to get approval for a medication before you can start, but also things like these different grant funds and medication-specific resources. Billy is the queen of all these things. So if you haven't met Billy already, you probably will soon. Obviously, being virtual or remote makes it a little more challenging, but we're really fortunate to have someone who can help us make sure that patients are enrolled in the programs they need to be in. So a few things that I'll mention specifically. So our CF patients, some patients qualify for something called a Health Well Foundation grant. There are actually two different funds that are available. So there's a CF treatments fund that covers, for the most part, prescription medications. It's not an all-inclusive list, but it is pretty extensive. And then there's a separate grant called the CF Vitamins and Supplements grant. So this does exactly what it looks like it does, is it covers vitamins and then nutritional supplements. Those are both grants that are available to patients. They are financially based, so there are some income cutoffs, and so some patients do or don't qualify, but that's always something that we try and investigate because it can offer quite a bit of support. And then from an enzyme-specific standpoint, some of our pancreatic enzymes have programs that help with both financial assistance and then also help with getting vitamins and supplements. And we'll go through some of those here in a minute just to give some specifics. And then there are lots of other medication-specific resources. So things like the Vertex GPS program for the CFTR modulators. Pulmozyme has a financial assistance program. Most of the inhaled tobramycin products also have something similar. And so that's where Billy can really be helpful, because each time, we need to start a new medication, she's really able to help us think through what programs you may qualify or your child may qualify for now, and making sure that we're proactively enrolling in those. So I'll talk a little bit about just the specific pancreatic enzyme programs, because I think they're unique in that they're not just based on, or not just offering financial assistance, but also some assistance with other products that you may need for your child. So for Creon Care Forward, this is for patients who have commercial insurance and meet some eligibility requirements, but it does offer both a copay card, so it helps with the copay for your medication on a monthly basis. And that card is something that your pharmacy can just run at the time that they fill your prescription. But then they also offer free CF multivitamins, as well as some nutritional supplements. So the way that most of these enzyme programs work, they have an online portal. Using the copay card is actually how the company knows that you are indeed, or your child is on the appropriate product, and so therefore qualify for the free offerings that they have. But here you can see on the Creon Care Forward card, if you didn't already have one, you could sign up for the copay card. But then you're able through the portal to order your nutritional and multivitamin products at no charge. So here, if you click on the first one to order your nutritional and multivitamin products, you'll be asked to give some information about what kind or how long your prescription is for. So whether you fill, in most cases, a 1 month or a 3 month supply. And then you're able to choose the multivitamin that your child should be on from a drop down here, and as well as a nutritional product if that is something that you need and want. ZenTop has a similar program called Live to Thrive, and it has very similar requirements. It similarly has a copay card that helps with copays each month or every 3 months, depending on how you fill your prescriptions. And this program actually offers every month free CF multivitamins, an additional vitamin D supplement if that's something that your child needs, as well as nutritional supplements. This program also has a fun reward point system, and we'll show you in a little bit some of what you can use that for. But you get reward points each time that you fill your prescription. You can also go in and do some quizzes and some fun activities to get extra points. So that's a fun way, especially as kids get older and start taking some ownership for their medications. There's a little incentive to get, and you can get some fun things with that. So this is, these are some of the things, and this is definitely not all inclusive, but some of the things that you could use your extra points through the ZenPep Live to Thrive program to get. So some of them are very functional and useful, which as parents we really like. So things like a new chamber or spacer for your child's albuterol inhaler, a new nebulizer cup, and even some additional multivitamins if that's something that you needed for any reason. You also can get some fun things like gift cards to Amazon and I think Dick's Sporting Goods. So you can definitely choose to use them either functionally and very practically, or for a little fun extra, depending on what makes sense for your family. And then pancrease is one of our other pancreatic enzymes who similarly has some additional offerings outside of just copay and financial assistance. So here you actually sign up for the Pancreas Engage program and you receive a monthly savings code to use in their store. Similarly, you have to have commercial insurance and meet some eligibility requirements. But again, like the other programs, the nice thing about this is that this is a nice way to help with obtaining free vitamins and supplements, since oftentimes those are things that just aren't covered in the same way as our prescription drugs are by insurance. So I think this is where I'm going to stop talking. I'm happy to answer any questions, but let Charissa take over with some med organization tips and then the fun technology of the apps.
Thanks, Cameron. Like Cameron said, I'll start talking a little bit about medication organization tips. So one of our favorite things is the pill box. And there's the lovely picture right here. The kind of nerdy pharmacist in me, I've gone onto Amazon before and looked at all the different types of pill boxes that are out there. So if you don't like one, there are lots of different options. You can get them online, definitely at your local pharmacy or Walmart. It comes in all shapes and sizes. Like this one has a nice carrying case, but you can also take the day-to-day ones out. There are some with multiple slots for the different times of day. And just like Cameron had mentioned, the pill box also is helpful, especially if your child's on a lot of pills like tablets and capsules. It's a nice way to also help keep track of refills as well. And then the pill boxes that kind of pop out, it's helpful for those of you who have older children, maybe they're in school or they're in college, and you can just take out the whole, your day's worth of pills and kind of go from there. Many of our CF patients require enzymes, and especially as they get, towards adolescence and maybe into college, and they're living their lives like we want them to, but sometimes it's difficult to remember to take their enzymes, and folks don't like toting their huge bottle of enzymes around with them. And we don't want you guys leaving them in the car, to be exposed to the heat. So they do make keychain pill boxes like this one, or little pocket pill boxes. And so, kind of depending on how many capsules of enzymes y'all have to take, those can be helpful to just have something that, hangs on a keychain or on your lunchbox or something like that. But even if you don't want to use something that fancy, you can also even just use an old school Altoid tin box and throw some enzymes in there and kind of go from there. Some additional tips, different organizer drawers or cabinets, even just repurposing a lot of those fancy or crafty organization tools. So here I have an example of like a small drawer, and this might be helpful for families who have younger kids, and maybe if they're on a lot of liquid medications. This is a tip that I had learned from actually another family, where if it's safe and appropriate for you to draw it up in advance, you can draw them up and then kind of put them in the different drawers. So whether each day or each drawer is a different day, or each drawer is a medication, sometimes that can help. But again, those that only applies to medicines that it's safe to do so. So unfortunately, for example, like the liquid multivitamin, it needs to be protected from light, so probably wouldn't be a great idea. But if you have questions about which medicines can or can't, Cameron and I would be more than happy to answer those questions as it comes up in clinic or here today. And then another thing is, you can sometimes ask pharmacies for extra oral syringes, and some pharmacies are willing to do that. And they might also have these little syringe caps, which would allow you to draw up those doses in advance. So sometimes it saves you a little bit of time if you can kind of batch them together. And if the pharmacy isn't able to provide that, and it's something you would like, you can buy these syringes and the caps online. And some pharmacies also sell these. And generally speaking, these syringes and the caps are reusable, after you wash them a few times, and that's totally okay to use, as long as the markings aren't fading on the syringes, and that the caps are still fitting nicely. But that can also be helpful if you're traveling or coming to appointments, you need to bring your medicines with you. We've had some families bring them in like Ziploc baggies. And then kind of another one is getting a cart or a large tote for nebulizer equipment or your vest. So this is actually from a CF blog, a CF blogger. So as you can see, they have a nice cart where they've put, excuse me, their child's vest and their nebulizer and cleaning supplies and things like that. There was another nice blog. They said apparently there's this cart from IKEA that's like the perfect size for their vest, and all of the different aspects. And so, depending on your child's age, there have been some families that have had their children decorate their cart, kind of stylize it to themselves. And then also, large clear totes to organize, your nebulizer equipment, medications, like the non-refrigerated ones. So at this point in time, whoops, it did not want to pop up. I had a little question on here that was going to say, what different strategies have you guys used? And if anybody would like to chime in, we'd definitely love to hear some of your organization tips.
I mean,
I guess for me,
I do have a question there.
Go ahead.
It's good for when you do at the home, but like suppose if you go for traveling a month or anything, like you do for long travels or out of country travels or anything. So what is the strategy is better to like, because you get like 2 months or 3 months supply one time. So how do you have any organization tips there?
That's a really great question. I think one of the big things, if you're going to be doing you're planning a prolonged vacation, is first to let our team know so that we can start working with you all for letters. And then also, we can try, depending on insurance, see if, depending on how long your trip is, seeing if we can get a 3-month supply approved, or a lot of insurance companies will also allow for a vacation override, so an extra fill. And so kind of depending on how long your trip is, that is definitely something you can let us know about in advance, and we can help work through all of that. In terms of organization tips, kind of on the move and during travel, that is a little bit more challenging, since I know you'll be kind of limited on space. It's also challenging because I believe there are federal regulations that they do want the medications in their original bottles so that they can verify what the medication is. So unfortunately, in terms of like consolidating things, it might not work as well. But what you could do, for example, if your child is on a lot of pills, you can still bring a pill box with you and maybe kind of do a mini setup while you're traveling, and still fill, once a week, the pills and things like that. I don't know if that helps answer your question.
No, I think it helps. The same question, I think in the schools also, they looks for the label and pharmacy and everything. So that also makes me like it's not able to use this pocket pill boxes and everything.
Correct. So usually, if your child's still in public school, they definitely still need the prescription, the bottle that's on it that has the label. But some of like the keychain pill boxes would be maybe for some of our college age students or our young adults who are maybe working a part-time job, where maybe during lunch break they don't have time to go to their locker or whatnot, but it's helpful for them to have it kind of on hand if they're grabbing a quick snack and can't go grab their full bottle of enzymes.
Thank you.
Sure. I think Ms. Capano, you were going to share something.
I was just gonna say that for like every day and during COVID, it's been really like simpled down a little bit because we're all home. My husband and I both work from home, and we do have someone that comes in and helps, but we're both always there for any questions. Prior to that, we had, when we were both going out to work, I had like a notebook, a 1-inch binder for each kid. And I had like spreadsheets in there, and they would know what to do at what time. And we would set alarms, and they would know to just go check the spreadsheet. So it was kind of, nothing would get missed.
That's
I know it's
fantastic.
crazy, but it was 2 kids, so it was just a lot to try and manage for another person coming into our home to help us manage it.
Absolutely. Like we said, y'all are superheroes, so hats off to y'all. All right, I'm gonna keep going. And so some other tips, this is actually straight from Pharmacies. I know we ask you guys or encourage you guys to keep extra on hand, especially for things like your enzymes or other nebulized treatments, or, you know, even if we say, okay, we're doing a course of inhaled tobramycin, but still hang on to some extra until we know if we're truly done with that. And so we know that takes up space. That can be a lot of bottles that are difficult to figure out, like, is it open, is it not? So there are a lot of families that do have like a closet or a cabinet full of their extra medications. And so if you're super organized, maybe you can like organize it by like when things are going to expire. So things that are going to expire earlier up in the front. But this technique of putting an X with a permanent marker either on the top of the bottle or on the front of the label is something that we do in pharmacies a lot. And it just tells us, oh, this one's already open. I've also heard, you know, some families trying to make sure, you know, their child is getting their enzymes. They got bottles of enzymes everywhere to be in this line of sight. But having kind of an X on top of that can identify which ones are already open. We've heard from some families that they like to use a big tote, a clear tote. But sometimes I wish somebody would invent something where you could print the labels or the names or something on the tops of medication bottles. But it can be difficult to figure out, okay, I know my cyproheptadine was in a smaller bottle, but I don't know which one out of all of these. So you could put stickers on the top of your different bottles. You can create your own key so some people might say, I put a yellow sticker on the top for all of my morning medicines and a blue sticker on top for my nighttime medicines. So that's one system. Some people will do a different colored sticker for your 1 time a day medicines versus your 2 time a day medicines. Other people will have the little stickies and have what time they're supposed to take them on top of them. Other families, this is an example, this was not specific to a CF patient per se, but it's really hard to see on here, but they actually have abbreviated medicine names on the top of them. So it's easy for them to kind of pull out of the tote when they're filling their pill box or they're taking their medicines. But you kind of can use whatever system you would like. Places like Office Depot or Staples have lots of these, circle stickers, or if your child has a favorite character and wants to decorate the bottles, you can do that together. I mentioned, the extra cabinet space or closet or totes for your extra medications. Just make sure it's stored. All medicines are stored in a safe and secure place so that your pets and your children can't get into them. Sometimes we've had families, if you're a pen paper type person, have a calendar or a checklist that you, with your child, if they're old enough to or motivated enough to, can check off together. Oh, and here was my thing. What other ideas do you have? So I've let you guys kind of percolate on that a little bit, but any other ideas or other questions?
And this is somewhat related, but we put like a spreadsheet, like kind of like what Kat was saying, but on the inside of our like one of not the pantry door, but one of the kitchen cabinets, so you could flip it open and just list it out. Like it did list out the medications for each child, but there was also like a list of the pharmacies and which drugs came from which pharmacy. Absolutely. With phone numbers. So that it took some pressure off of me, so that I didn't have to feel like I was the only one who knew all this information. It was there.
Yes, so absolutely.
It's not really related to the pill organization, because we do have backup spaces and closets for that kind of stuff too. But
yes. We've definitely heard other families mention the same thing, you know, especially if, you know, maybe parents are taking a vacation and somebody else is stepping in, you know, having all of that written out kind of on the inside of a cabinet. Have definitely heard that strategy as well. Thanks. All right. So it's time to take your meds, everybody's favorite time. And as you all know, even better than both Cameron and myself, there's a lot of medicines, and trying to get your child to take your medicines. There's different challenges at different age stages. So maybe even as an infant, right, it's trying to even get it into them. And then when they're younger, maybe it's a taste issue, a little older, but still a young child. And then, you know, you get to adolescence and you have your usual teenage behavior where they don't want to take their medicines. They don't want to listen to y'all or the team. But there's a lot of different age appropriate strategies. And that's what we are here for as a team, to kind of walk alongside with you. Y'all have probably tried more things than we can even think of. But we love hearing y'all's different strategies as well, so that we can share them with other families too. But some strategies you could consider maybe with younger kids, like a sticker chart. Each time that they take their medicine or do their treatment, sticker goes on a sticker chart. And if they earn however many, they can get a special reward or a special snack or food or activity. So that kind of ties into the reward system. Sometimes some of our teenagers are motivated by other things a little bit bigger maybe than, you know, stickers, but I think we all are kind of creatures of motivation. If we have a little carrot dangled in front of us, it can help. We've had families say, you know, they will give, for example, their airway clearance time a fun name. So I had one family say when their child was younger, they called it the puff game. And even though their child is now a teenager, they still call it the puff game. Or somebody, you know, with a younger child that's on some of the granules of the modulators, they call it their magic sprinkles when it's time. So giving a fun name. That probably will wear off over some time, you know, when they get older, but you never know what will stick with your child. Sometimes allowing your child to do something special, for example, during their airway clearance time, you know, if, you know, there's only certain times that they're allowed screen time or allowed to watch their TV show, it might be just during their airway clearance time, or playing video games or what it might be, whatever it might be. And then as they get older, helping them understand what their medications are for. Obviously, we would describe the purpose a little bit differently with younger children and to our adolescents. But something that I like to do is maybe come up with similar analogies, maybe to their favorite character, if they're in a Disney phase or superhero phase, and you know what certain medicines kind of might match up. So for example, hypertonic saline might be really similar to Aquaman, or Pulmozyme similar to Wolverine or something like that, just to help them kind of make it a little bit more fun. Definitely reminders. We'll talk about some of the apps that can do that, but even if you don't want to download an app, I feel like a lot of people have one of these, a smartphone. And so most phones now, you can set a daily alarm, for example, or you can set routines. If you don't want to set an alarm, you could set a daily calendar reminder, either on your phone, or if your child has a phone and is old enough, you can set it on their phone as well. Some folks are more visual. So if you like sticky notes, colorful sticky notes, placing those in kind of your line of sight to help remind your child. Maybe it's a sticky note on the bathroom mirror, or somewhere that they're always going to be, or I don't know, on the microwave. Remember to take your enzymes, or your refrigerator. I've also had a child tell me once that they were very annoyed by their caregiver nagging them constantly about their medicines. But then a few weeks later, kind of had an about face and said, "Oh, I actually really like hearing your voice." And so we half joked that we should just record their caregiver's voice on their phone and set that as their alarm. And so they would hear that every time they're supposed to be taking their medicines. But there are some fun, creative things we can do with phones and things like that, which leads us to different technology solutions and such as phone applications. So the first one I'm going to talk about, and we're probably going to spend the most time on, is Med Action Plan, and the corresponding phone app is called My Med Schedule. And the main reason for this is just because we, on the pharmacist side, we actually have a web-based portal, and we can actually enter these medicines for you, so you don't have to manually enter that. And then we can print you a list with the schedule that looks something like this, and we can tailor the times that you would like. The app itself does have pictures of what the medication looks like, as well as the strength. And then as you go across, it tells you how many tablets to take at what times. And then it also lists out the purpose of these medicines. So definitely helpful for some of our adolescent patients as they're starting to learn more about their medications. And it also has different notes at the bottom. And there's even like a fun little icon for the vest. And then we can also print checklists for you. So the program is smart enough to know, for example, azithromycin, it's usually a 3-time-a-week medicine. And so it'll actually block off the days that you're not supposed to take them, but it has a nice checklist function. If you like checklists, we've had families laminate this, or we can laminate one for you. You can put it up on your refrigerator and just use a dry erase marker to kind of check off each week. And then at the end of the week, kind of erase it and start all over. So there are in the app a few other features as well. If you all are interested, I can show you guys a live demonstration if you would like, as opposed to going through the individual screenshots. I saw a question about, does it allow for multiple children? It does, actually. So let me share my screen for the app. That's why I'm on the Zoom twice. And let me share.
Will this connect it to even the CF Care Center where they can identify it? Yes, these are the medications taking and these are the times they're taking, kind of. If the data can share to the Care Center also?
Right now, the app doesn't talk back to us. We can see different aspects of, you know, how frequently, you know, how compliant patients are. But with the app, as you can track that, and we can track that as well. But usually we will talk with you guys in advance as we're putting them in as to what your preferred schedules are. But even after we've put all those things in, you also have the ability to change the times, or if we say, you know, we're adjusting the doses, you can change that on your own, or we can do that for you, and then it'll get pushed to your app directly. So hopefully you all can see my screen. So here is an example medicine list, and here's the schedule. And as you might be able to see, let me see if I can get my pointer on here. So as you all might be able to see, there's a today screen at the bottom. And so on the today screen, that is where you have all the medicines for the day. And so, for example, if you have a Monday, Wednesday, Friday medicine, today's Thursday, so it won't show up on here. As you can tell, I am clearly non-compliant with my medicines today. And so there is a little orange triangle up in that upper right-hand corner. But if you swipe to the right, you can mark it's been taken. If it went off and you didn't want to take it, you can snooze it, or you can put in different options, for example, hold until later today, or we're skipping it today. And all of these things are logged under progress. So here's this other tab. And you can see kind of how well you've been doing over time. And so to the question about if there can be multiple profiles, yes, there can be under one account login. So This one is CF test. I have another one that's just called chaos, but you can add multiple ones. So if you have multiple children, you can definitely have different profiles as well. So aside from the Today screen, you also have the second to the right is the med list. And this is where all of the medications are listed. And so this is where you can click into it. You can change the time if you would like to whatever time would best suit your schedule. Ideally, we'd probably say, you know, if compliance has been a problem, probably would say to not turn off reminders, but you do have the option to turn the reminders off for certain medicines as well. And then here is also another spot where you can set refill reminders, which can also help streamline maybe your calendars, multiple calendars and things like that. But when you click on the set refill schedule, you can program when your next refill is due. And then based off of that, you can tell it how many times you're supposed to be filling it. So do you have a 1 month supply, 2 month supply, or a 90-day supply? And then it'll automatically kind of calculate that for you. And then you can enter how many refills you have remaining on your active prescription. And then you can also turn on the reminders, and then based off of when you want it, so a week in advance, or you can change the number of days in advance that you would like that reminder to go off. And then if you want everything in one place, you can also enter things like the prescription number, which they usually ask for on the pharmacy when you call for refills, where it's at, and the pharmacy's phone number. And then you do have different notes also at the bottom with regards to how to take it, other special things about the medication. And MedAction also has been working on a few other kind of educational things for our CF patients that have not been released yet. There's also an option for your care team for contact information, and you can add individuals as well, or you can add your medications. Whoops. And then one other nifty feature now is, for example, if you want to print the lists that I had shown you, there is an ability to do that now if you click the share button. And then you can print either that full medication schedule that I had shown you earlier. You can also print by medication your medication schedule by time. They have wallet-sized ones, and then the different checklists. And when you do that, when you click that and you click share, you can either text it to somebody, you can email it so that you can print it out, those types of things. So, so those are some of the nice features with MedAction. Any additional questions about MedAction?
The only other thing I was going to mention as people are thinking about that is that I know, Ms. Capano, you asked the question about multiple children, but you can also have multiple caregivers log in to the same patient's account. So let's say mom and dad, or you have a grandparent helping, you just log in with the same login information, and as one person updates it to say, yes, we took our morning meds, it's probably not simultaneous, but it does sync and would show up on someone else's that's logged into the same account that, yes, we did indeed do our medicines this morning. So in some cases that might be helpful.
Thanks, Cameron. All righty. Any more questions? Action. The name of the app is, it is abbreviated MMS, but it is My Med Schedule Plus. So, and usually if you let us know that you're interested in it, we can upload your medicines for you. And then when we link your account, basically all you need is an email address. We can link your account and it'll send you an email with the direct download, either from the Apple Store or Google Play, because they did have an older version. And that way that direct link makes sure that you, and ensures that you download the appropriate app. Any other questions? All right. And I didn't mention this earlier, but there are a lot of medication adherence apps. So it's not to say that you absolutely have to use this one or the other two that we will show briefly today. But, you know, pick one if technology and apps are your thing or your child's thing. It never hurts to try it. So My Med Schedule Plus, I should say, is free. And then these next two that I'll talk about are also free. There's also a lot of other apps out there. So this next one I'm going to talk about is called Mango Health. And this one, as you can tell, very fun colored, lots of fun color schemes. This one, like I mentioned, is free, but it does require that you add medicines manually by yourself. We aren't able to upload that for you. So depending on how many medications your child is on, that may or may not take a little bit of time. This one is fun in that it does actually also have a rewards point system. So as you are marking, you know, if you've taken your medicine or not, you accumulate points. And as you accumulate points, then you can enter into different drawings for example, gift cards. So that's kind of a nice tangible motivator. This one is nice that you can also have a family member check in. So say you have an adolescent and you're trying to give them a little bit more independence and you don't want to make them feel like you're constantly hovering over them all the time, you can have a check-in. It also has refill reminders that you can program. And then these are what the pop-up reminders look like. So it's mango time. And then you have, you know, when your medications are due, and then noting if you've taken it, if you want to snooze it, or if you're skipping for later today. And then it'll track your, what we call adherence, so how well you're taking your medicines. It'll kind of give you a report for your lifetime that month. And then it also has different tracking features for example, maybe you want to work on hydration or your weight. You can log these in the app as well. You can also log your mood and it tracks that for you. And then it does also offer different drug information notes as well as interactions depending on the medication. So this is a fun app. And then there's another one. This is a little bit more geared towards adults if you look at kind of, you know, the layout and things like that. But this is one of the more popular and most downloaded apps as well, but it's called MediSafe. And similar to the Mango Health, you do have to enter those manually since we don't have kind of that overarching provider access. But it also tracks adherence history based off of how you are marking if you're taking medications or not. They have different educational videos on the medication. You can also add medication notes. So for example, if your child is having headaches or having upset stomach, or it might be related to a medicine, and we've asked you to kind of track some of those things, you can also add medication notes to individual medications. There are very fun reminder ringtones, which I will play a sampling of in just a little bit, but you can personalize them to certain types of medications. So there's like Minions, there's Dory, there's Darth Vader. So we'll get to hear from some of them shortly. And then you can also track different measurements. So maybe we're asking you to track your blood sugars. It has a place for you to add those into the app. And it also has an option to alert a friend. So kind of a nice accountability. Again, maybe you have an adolescent that we're trying to encourage independence. So maybe they're deciding to snooze multiple times. And so you can say, make sure that a friend gets alerted if you've missed a dose, and they can kind of be your accountability system as well. But any questions about these apps or other apps before we end with some fun ringtones to cap off the night? If not, I will proceed and you guys can think as we're laughing at some of these. So if it will proceed. Okay, hopefully this will work. Uh-oh. There it is. Okay, so we'll hear from the Dory ringtone first. So hopefully y'all can hear this. Maybe.
I don't know what's going on. I think I forgot something. You know, this whole short-term memory loss. Oh, no. Wait a minute. Isn't it time to take my meds?
Uh-oh. Sorry. Paused.
I don't know what's going on. I think I forgot something. You know, this whole short-term memory loss. Oh, no. Wait a minute. Isn't it time to take my meds? Hi. Hello? Excuse me. Dory here. Hey, I'm lost. Do you have some directions? Also, wait. It's time to take your meds. When life gets you down, you know what you gotta do? Just keep swimming, swimming. What do? We swim, and we take our meds, and we just keep swimming, swimming.
All right, thank you, Dory. Maybe you like the smooth voice of Morgan Freeman.
It's time for your meds. I know what's good for you. You know what's good for you. Go on, take your meds. Hello, this is the universe speaking. You know what time it is.
Thank you, Morgan Freeman. Or maybe you are a little bit more Sith, so you need a Darth Vader, or you don't want to be Sith.
If you don't take your meds, it will be easy to bring you to the dark side.
All right, if that doesn't scare you, maybe you need a little humor or a little craziness.
That's right. Meds. It's time. Time to take your meds. Take them.
All right, or maybe some of you parents will hate us for this, but here's Elsa.
Take your pills, take your pills, can't miss a dose anymore. Freeze, time to take your medications. Let my health stay strong. I'm gonna take my meds anyway.
Thank you, Elsa. Maybe you have a little more sporty child, maybe like baseball, so.
Take your meds so you feel well. Try to take them on time. Strike one, strike two, strike three. Your pills are out of here.
All right. There are a total of 14 different tones that you can choose from, or you can record your own. But we just wanted to put that out there. That was something that might interest you or your child. But at this time, we are happy to take any questions or comments. And please feel free to share any additional tips that you have found useful as well.
Hello.
Yes.
It's not this, not a question or anything. And you repeated you can connect with my clinic or my pharmacy team. Was not a bit clear because I got this invite from my CF care team. I'm not sure which team I have to connect or anything.
Sure. Now, are you seen at, I'm sorry, I'm not really sure who you are. Are you at the UNC CF Center or are you at another center?
We are in other center actually.
Yeah. Different centers, they have multidisciplinary teams. So there's your nurses, your pulmonologists. I'm not entirely sure all the team members at your particular center, but it certainly doesn't hurt to ask if there's a dedicated pharmacist that can help you all with some of those things. But if not, if you're interested in some of these apps, like I mentioned, they are free for you to download on your own, even, for example, like the My Med Schedule Plus. Any other questions or comments?
do we have an option to transfer medications to your pharmacy?
What state are you all in?
We're in North Carolina, Charlotte.
In North Carolina. I believe, it'll still depend on your insurance, if our particular pharmacy is contracted with you all. But yes, outside providers are able to prescribe to UNC shared services. As a caveat, I will say Cameron and I, for example, we are not working directly in the dispensing pharmacy, but we do have a team within the specialty pharmacy that is kind of dedicated to cystic fibrosis that will be making those phone calls if you're on specialty medications, for example. But I don't know if there's anything else you'd like to add with regards to that, Cameron.
No, yeah. Certainly anyone in the state of North Carolina can utilize UNC shared services. Like Charissa said, we are based in the clinic, so see patients at their quarterly clinic appointments, but we'd be happy to connect you over with the team there. There are certainly patients. It's the name of the pharmacy, I see your question, is UNC Shared Services. And we can put the contact information here. And you could just ask your provider at your CF Care Center if they could send medications there, and then the pharmacist there could help with getting set up there if your insurance allows it.
Thank you very much. I don't know if anyone has any other questions.
So just a question for, again, going back to the doing a long travel, or when you're going out of, I know we're on COVID, we're not going for any vacations at this stage, but many people are waiting to go for their vacation. So what is the recommendation to carry the Pulmozyme or a Toby, which has a refrigerator, and they'll not allow in the, how do you carry in the airplane, which has sometimes 16 hours of journey, and what are the options you suggest for that?
I can share what our daughter did. She went to study abroad in Scotland and had to transport 6 months of medications with her, and including the Pulmozyme and Caistin, which is also refrigerated. And so she, she on the plane with her in person, she had letters, of course, from the doctor saying she needed all these medications. And then if you're carrying on medical equipment, even if it does not count as a carry-on bag, it's a separate medical bag. So we got medical labels for her smaller bags, and they did give her a hassle, but it's not, they can't tell you, you're not supposed to check your medication. So on her, like, she had a one whole carry-on bag that had her nebulizer in it and all her medications that weren't refrigerated, or maybe not all of them, actually, probably most of them.
Full.
It was so full. And then we had another bag, which was a hard-sided rolling bag that we put ice packs in with her refrigerables. And she had to, she had to stop. It was an international travel. There were 3 legs to the trip. And so she, at each stop, had to, and then she packed empty plastic gallon-sized bags that she used to refill with ice during the layovers. So it was, but it was, so it was complicated, but it was doable. I mean, she put several bags inside of each other so that they didn't leak, and had towels in there, but that's what she did. And I mean, she did have to take out some of the medication at in customs. They had her take out the little bottles of the medication and x-rayed them to make sure it was fine. So it was a bit of a hassle. So I would say, like, allowing extra time for that would be helpful and wise. But I don't know. That's what I could say that our daughter did, and it helped. It worked. She managed to go, and she took it all. She got everything there.
She had the documentation, and like Cameron and Charissa said, they were in their original pill bottles. They were clearly the medical prescribed, medications. So it was doable, but she was ready for the questions from all the, check through security folks.
Yeah, and Cameron was instrumental in getting some of the specialty pharmacies to actually dispense, more than 3 months at a time. So really, you came in at the end, like I was really pretty panicked.
Yeah,
I don't know if you remember, but I do. It was a year very helpful.
I distinctly remember. Yeah. It definitely, I think that's an important thing to point out, though, that, insurances do have things in place to allow us to override, whether you normally fill a 1 month or a 3 month, we can get additional supplies. But sometimes that's a process. So again, I think that's where your CF care team can be really helpful as soon as you know that a longer trip is going to be happening. I always like to start those questions sooner rather than later. But yes, I remember that.
Yeah, there was a lot of legwork and planning.
It took
Jen
two
spent a lot of
months,
time
actually.
on the phone
It probably took 2 months
with
ahead of time
from
planning
various
ahead.
folks. But it's doable.
But she was going for 6 months too.
Right.
Thank you very much.
You're welcome. Good luck. Enjoy your trip when it happens.
And planning on July, but on the same note, will she be able to carry the vest, and whether that vest works in other countries? Because some of the volts will differ between the country to country. So any strategy or any thought process there?
Yeah, we looked at that. There was an issue. I think we checked the battery in particular with regard to the airline and like the lithium battery, and she had to have I think we pre-approved it through the airline or something like that.
We did have to call the airlines.
We gave them a heads up, like, hey, she's going to be carrying this piece of medical equipment and it has this battery, and so we got that cleared. And then, the electrical.
Well, the vest system she uses is the Monarch.
Oh yeah, the Monarch.
And so it doesn't actually plug into the wall.
Good point. It has the battery.
And then the nebulizer actually, I misspoke. She actually did normally if she were to fly, she would carry that in the hard-sided bag with her medication, but the electrical wasn't compatible. So she actually ordered a nebulizer over. It was in the UK and had it waiting for her because we were told that to use the adapter, it could actually make she uses the nebulizer for several medications. So it's like a few hours a day. So it would be, probably burn out. So we had to purchase, she had to purchase one over there. Mm-hmm. But they do have travel versions, but for her amount of use, she needed the more durable nebulizer.
And I think that's the other thing, whether you're traveling in the US or internationally, letting your CF care team know, because they may have some contacts at a CF center that is close to where you're going, especially for international travel. I remember that was really helpful that we were able to identify a contact there who can answer some of these questions where we just wouldn't have the experience necessarily. So I think that's always a good thing to consider, is just making sure if there is a local CF center wherever you're going.
Thank you.
You're welcome. Anytime.
Yeah, thank you so much.
Yeah,
your presentations are, it's very helpful.